was really almost one of my boyhood connections. We were chartered accountants together, and he had had a desire to not just work in the community, but also do something for it. He was friendly with the late Dr. Jollis, and together they brought together an idea to have a hospice in Northampton.
Cynthia Spencer Hospice. He was totally dedicated to getting it off the ground. There wasn't a hospice. Ben Jollis started it off, raised this money. It went on from there. So there wasn't a hospice, actually, as such, in Northampton.
They managed to get a few trustees, people who were interested in the scheme. There must be records of who they were, but they also brought together people who were really leaders of the business community of the town. I was fortunate in that I was connected with the Northampton Chamber of Trade and Commerce and knew quite a number of these people who gave a hand to helping the funds forward.
He had been chairman of the Health Authority, Northamptonshire Health Authority. He visited the hospital and all the hospitals round and about. There must have been times where patients were dying, and not always were the staff able to be with them.
He was very much orientated as a community person, and I think it was that really inspired him to want to do something for those who had a condition which needed care in a specialised centre.
You know, I now see what a wonderfully peaceful place it is. Having experienced myself the difficulties and the stress, here we have a place that he was so involved with that before the first brick was ever laid, he was involved with that, with Ben Jollis. And then, you know, I found myself there with him, ill. It was truly a very, very difficult time.
Cynthia Spencer really goes back beyond the Woodland Trust. We gave some money some years back for the patient's sitting room, so we have a connection. And we decided that when Simon, who was one of our trustees, died, we would like to give something in his memory to a cause which was very close to his heart. The hospice suggested an outside room quite apart from the other buildings to which people could take their patients, perhaps in a wheelchair, for a quiet time together. And that was something we got rather keen on, and so we decided to support that.
He'd be so pleased. I mean, it was all running really well, you know, before he died. The fact that the Woodland room is going to be built, I mean, I think that's fantastic. You know, at the moment, the room that I know people do congregate is quite busy. And so this will be so lovely and quiet and private.
Just the sort of tranquility that people who are perhaps not feeling well but are able to go to and enjoy a quiet time with their families or friends.
And it will be private. This is the big thing. It will be private, and families can be together, which is so important.